Good afternoon, everyone, and you are watching In Session on WJZZ Cool TV, the coolest station in the world, and we are streaming live on Facebook, YouTube, Twitter, and Periscope. Enjoy classic jazz music anytime via WJZZ And you are with your host, Dr. T.
And Dr. Fishta.
And we are always talking mental health and everything wellness. How
Yep.
was your week this week, Dr.
Was
Fishta?
really good and very busy with the new changes now, with the new orders about not a lockdown but a pause, as the governor called it. So the concerns with that, though, is when we talk about mental health, when we talk about substance abuse and addictions, which we're going to engage today in that conversation. And we already have seen a significant increase in mental health and substance abuse disorders. And the concern is what happens a month, 2, 3, 4 from now, and of course the long-term effects of this whole mess we're in right now.
Right, and now we combine that with the holiday season where traditionally addiction, whether it be alcohol or substance abuse, is on the rise anyway.
Yep.
We have to now accompany that with COVID. So
Correct.
we are definitely going to see a spike in drug use,
Yep.
alcohol use,
And unfortunately in overdoses
yes.
and people dying, basically, which is very unfortunate. And we usually see a spike around the holidays. And it is based on my observation. Oftentimes people miss their family, their loved ones. There's so many triggers for relapse or increase in substances, sometimes trauma and so forth, that can affect the addiction. But generally speaking, basically addiction is a brain disorder that is characterized by compulsive engagement, all in all, to reward a stimuli that has adverse effects, basically, and one of them being the addiction itself, meaning that you're going to need more and more to get the same effects.
exactly, and build
forth.
up a tolerance for it.
That's correct. That's
Yeah.
correct.
And I was reading, I believe the CDC says that 4.4 million Americans there's an increase during this time between October and January. Is the highest reported deaths from addiction.
Yep.
Yeah, about 6% are affected by seasonal affective disorder.
Of course, we have a 5% increase, right, in seasonal affective disorder, which the emotional functioning obviously will impact the use of substances in order to what we would call like cover the emotions and or put a band-aid, and basically you see an increase in relapses or even new users. Now, keep in mind, not too long ago, Substance Abuse and Mental Health Administration, they really pushed hard to educate the clinicians and public at large that the substance abuse and addiction is actually a disease versus as prior to that it was considered a behavioral problem, right?
Exactly.
And the major change there, the shift was, number one, they can see either in some cases genetically, in some cases through brain scans, where they can pick up changes in physiology.
Of the actual brain,
that's
right?
correct.
There'll even be sometimes some gray matter,
Correct.
Which is showing.
Particularly with heavy alcohol use, the gray and the white matter, they both shrink over time. Actually.
Exactly. Exactly. So I am glad that we are having this discussion, especially so early, so we can have people aware of how they cannot overdose or overdo it during the holidays. And we will have a guest coming in at 5:15, well, not coming in, but calling in at 5:15. Bailey McLeod, is that McLeod?
I believe it's Dr. McLeod, correct.
Yes, Dr. McLeod will be calling at 5:15, and we're going to talk more about addiction, how it impacts us, and she's going to even give out some suggestions for treatment.
Yep.
So that I'm really excited about that, even though this is a hard topic to discuss, especially when we have family members that are dealing with addiction and they have been dealing with it for a long time. This is the time where there can be a lot of conflict
Yep.
within the home because you're dealing with a person that is using substance, and now they're causing problems within the home because they're trying to either get money from family members so that they can obtain their substance.
Even the change in behavior itself, right? Oftentimes, close family members will quickly pick up on changes in behavior. Sometimes they're the last ones to do so, right?
Right.
But all in all, it impacts the quality of relationships in a major way. Either be intimate relationships, either be family relationships, either be workplace relationships, and so forth. So it's not only the person actually who's addicted, having a relapse or increase the substance use, is the society at large that does feel the impact of this.
Absolutely.
Yeah.
And a lot of individuals that use substance during their addiction, they don't really realize the impact that it has on their children.
Correct.
The neglect,
Yep.
excuse me, from the
Correct.
parent not being present.
Correct, because looking at the substance itself and its use, right? One of the purpose that it serves is it gets the person out of a reality that is perceived as painful, the emotional pain, it'll be depression, anxiety, and other conditions as well, which we still clearly don't know which comes first, so to speak. Generally speaking, in the field, there's also an increase in obviously on emotional states. People when they use substances, and oftentimes leaving people with significant withdrawals when there is absence of the substance itself. So all in all, major impact in overall person's life and those who are around them, so to speak.
Absolutely. So we're going to talk about all of that tonight. And again, we have our guests coming in.
Yep. Dr. McLeod, I believe it's pronounced McLeod. We'll check on that, though.
Yes. Now, some of the other areas that addiction is why it's so rampant. We talked about loneliness. We have a lot of individuals that don't have family that either live with them or live in the same city or town, or even state for that matter, or country.
Correct.
So there's a lot of loneliness that contributes to the holiday blues.
Yep.
And there's also, you mentioned grief, with reminders of loved ones who are no longer here with us.
Triggers,
Yeah, so these are the things that can, and Dr. Fishta used the word triggers. So triggers are, for people who are not familiar with addiction, are those things that cause a person to drink or drug. So it could be a smell, something as simple as a smell from a traumatic event that they went to. It could be
noises. Could be we've seen clients who actually on a garbage day, because they've served in the military, that's their trigger, major trigger. For obvious reasons, having walked through cities and towns where bombs would be possibly. So you have triggers that ordinarily most people would not think about. Now, even the triggers, you work with an individual through therapy, right? That's one of the big areas to explore, because once an individual is able to identify the triggers, they usually could have a lesser impact in the overall functioning. The worst is when these triggers show up and you don't know what's a trigger and what's not, so to speak. So
exactly, because even
the
person,
unconscious, other words,
right? Because a person can even be a trigger.
That's correct, of course, right?
So
depends on what the trauma, what the experience is, and so forth. Correct. Yeah.
Right. I remember having a client who I triggered because I reminded them of an aunt that was very, very mean to them. And every time they would come into the session, they would instantly get this angry unit on their face. You can literally see their facial expression change the eyes got narrow, the wrinkles in the forehead.
What an opportunity to explore that with the client, right? So,
Exactly.
and exploring that in that way, the hope is that it helps the individual less and less be impacted by such looks out there and recognize that that's what's happening, so to speak.
Exactly. And those are things that even us as counselors, we have to be aware of. A lot of
course.
people don't realize that us as counselors, there are things that can trigger us as well.
Of course,
when
you
we're
have
in the
what we
sessions.
call countertransference, right? And that's why supervision oftentimes comes in handy for
Absolutely.
counselors for obvious reasons. Yeah.
Especially if you're a beginning counselor, those first 2 years are
Correct.
really
Yep.
critical for getting supervisions. For instances,
Which
when
is
this
mandated
pops up.
through the state, right?
Yeah.
Yes.
Yeah.
So,
So,
right.
thank God we have state
Yeah,
boards
yeah.
to monitor all that. And every state has a state board.
That's correct. Yep.
And
of
most
course.
states have even a counseling association that helps guide you as well.
Correct. You have the states counseling association, and you have the national one as well, the big one that helps with all kinds of policy, ethics, and so forth. Yeah.
Right. So we are just about at our time to do paying some bills and things of that nature. But before we get into doing that, Dr. Fishta, what's your favorite holiday memory?
Oh boy, it's for me it's always Christmas, right?
Okay.
And where I come from, there wasn't a lot of presents and things of that nature, but somehow you could feel the atmosphere, right? Maybe you got a plastic ball or you got a pair of shoes, and that was a big.
Oh,
present.
so no Xbox or
No. The richest neighbor had a radio, right? So it's basically the atmosphere and the social togetherness, so to speak, that always made a difference. And we had goodies to eat, the sweets, and we had oranges, we had apples. It was different. It was not every day. Now trying to impress the kids now, it's totally different story.
Oh yeah, if you
But
spend
asked
less
me,
than $500, you're in trouble.
how about you? What is your favorite?
Well, I grew up a little bit different. I grew up with one side of my family being Muslim, so we didn't celebrate holidays. But on my father's side of the family, we celebrated Christmas there. But because I was Muslim, I still didn't get gifts.
Oh boy.
Yeah.
That's not fair.
Well, and one year, one of my aunts felt this way, my Aunt Renee. She said, you come over here every year for Christmas, you watch everyone else open up their stuff, and you have nothing. So she gave me a pair of I think it was like a hat and a sweater or a scarf. So, I mean, it wasn't nothing really extravagant or anything, but I was so happy and thankful that she included me.
Yeah.
So that because let me take that back. That's my favorite memory, but when I was younger, my mother had a boyfriend and he celebrated Christmas, and she was with his kids, and we had the biggest Christmas. We had the tree up, we all decorated. We got to stay up to 2:00 in the morning. That was the
You
first.
pulled an all-nighter.
Yeah, almost. First time having spiked eggnog, which I think that's what took us to sleep at 2:00 because we were not trying to go to sleep. We were trying to see Santa.
Yeah.
So I think that was my fondest memory, being with my mother, her boyfriend, and his children, and just having such this miraculous Christmas that I'd never experienced before. So, and I had a pretty dress and everything. I remember that Christmas very specifically.
Nice.
Yeah.
Nice.
So I don't have children, so I don't get to cherish those memories with any children or have pictures or anything like that. And you have children.
I
though.
have two now. The memories are really good until they become by mid to late teens. That all changes. Becomes about friends. Becomes about expensive stuff. It's almost when you compare the generations, it's so different, and I don't know which one is better than the other. It's just different, and but it's challenging for parents trying to keep up with the Jones, so to speak, oftentimes, because my neighbor, my kid, my friend, my cousin, and so forth got this and that, and they give you a long list, and when you get that wish list, it's horrible. So, as they grow up, all the way to 15, 16, 17, it's a lot of fun, lots of good memories, and that slightly changes after that. But it's us that need to adapt, and kids, they're growing in an environment that is congruent and is normal to them.
Well, you know what? It is 5:15, and you are listening to In Session on WJZZ Cool TV, the coolest station in the world. And you are with your host, Dr. Thomas and
Dr. Fishta.
And guess what? We are getting ready to have our caller come onto the line with us, hopefully. So, Dr. Thomas and Dr. Fishta are waiting for our guests to join us. So, we have some bills to pay.
Yes, we are sponsored, and this show is made possible because of Omega Haagen Dazs in Ferndale, which is an excellent restaurant to eat breakfast and lunch deli. Even though their dining room is closed now, they are actually doing curbside pickup, carryouts, and so forth. And also we have Rick Ramirez, the real estate agent. He's an excellent guy, great, a lot of help. And his phone number is 248-789-5888 for any real estate needs.
All right. And do we have our guest on the line with us? All right. Can you state your name and where you're calling from?
Hello, this is Dr. Bailey McLeod. I am calling from Charlotte, North Carolina.
All right, Dr. McLeod.
Great to have you with us, Dr. McLeod.
Thanks for having me.
So let me ask, how long have you been in the mental health field?
I have been in the mental health field for 9 years now.
Oh, wow. That's quite extensive. And how long have you been working with addiction and substance abuse?
I've been focusing on addiction probably for about the last 5 or 6 years. I would say it was something I specialized in my doctoral program. I started getting a lot more involved with.
Give us a brief summary of your profession, so to speak, Dr. McLeod.
Absolutely. So I have worked in terms of substance abuse. I would say you see it everywhere you go, or in kind of area you work in. It's not really something that you can avoid. So, working with the college population when I worked in college counseling center, but more specifically, I've worked in a methadone clinic, a dual diagnosis inpatient hospital setting, and a substance abuse treatment program for homeless men in the Charlotte area. And then now I'm in private practice, where I do see and work with addiction, but given its outpatient setting, people who are kind of transitioning out of higher level of care, or people who need assessment and referrals to treatment programs specifically.
Thank you for that. So you mentioned methadone, which I'm going to ask you about that a bit later. But obviously, this opioid is a major problem. It's crisis actually here, even across Europe and other continents. And also, there has been a significant increase in substance abuse and addictions and relapses and so forth, given everything that we've been through within the last several months. What are you seeing, Dr. McLeod, on your side there? What is your experience and observation?
We have seen an uptick. I mean, in general, the opioid crisis and epidemic has definitely been ongoing problem. More specifically for 2020, since the pandemic hit, I have seen an increase in people seeking services due to heavy substance use, specifically alcohol. People are more isolated, staying home, not to mention undergoing like job loss and other kind of family stress. and that's really putting a toll, and people are kind of turning to drugs and alcohol more. And so I'm definitely seeing that showing up in my office. More severe issues, more people needing higher levels of care in hospital settings, as well as people turning to or increasing their substance use. And so I'm definitely seeing it a lot more.
Okay, go ahead.
No, I was gonna ask, as far as with the holiday season coming near, and seasonal depression, what has been your experience of working with clients that may be experiencing seasonal depression and using substances to kind of mask that depression?
Depression and substance abuse definitely go hand in hand. Especially this time of year, I do see people who tend to develop depression or worsening of depression because of the seasonal changes. The days are shorter. It's cold. We were staying inside more. The sun's not out as much, and that can really affect our mood and how we're feeling. It might turn to comfort food as well. So you might be eating more.
Which will cause another problem with being now people are saying they're obese and upset because they're gaining weight, which is going to cause more depression and stress.
Correct. It's a vicious cycle.
Absolutely. And so we're seeing higher rates of substance use during this time, especially when we put in the holidays, usually celebratory times, getting with family. Alcohol tends to be involved a lot more in these celebrations, or even just the stress of maybe being around family. For those who find family to be stressful, might increase their use as well.
So, Dr. McLeod, you mentioned alcohol, and some people will say marijuana could be for certain folks a getaway drug, so to speak, and so forth. At what point does one become concerned about the alcohol consumption? When is it that, in your expertise, that you want to make someone aware that it may be a problem? What are some signs? I guess I'm saying.
Great question.
That is a really great question, and that's a tough question in the field of really how do we discern the difference between social, moderate use and problematic use. And so we define that a little bit differently. From a diagnostic standpoint, we look at, can a person control how much they're using? So if I say, I'm going to go to this party and I'm only going to have 2 drinks, do I stick to that 2-drink limit? Or once I start, do I have a hard time stopping? Do I end up having more than I intended on a regular, consistent basis? Or do I have a hard time saying, tonight I'm not going to drink at all? And so that's one of the things about control. Is the person experiencing cravings? So when they're not using or drinking, do they have these strong urges that they find kind of overwhelming?
Okay. And I want to open up our phone lines for our listeners. If you would like to call in and ask any questions, please call in at 313-355-6018. Again, that number is 313-355-6018.
We have Dr. McLeod with us, who is an expert in the field and works, specializes in addictions, and has different areas of expertise. So call in with any questions or comments.
Dr. McLeod, do you see any difference between your clients that are in for substance abuse issues that are not using methadone? Do you see more stress and strain with those that are just using regular counseling sessions, or more distress with those individuals that are being treated with methadone?
Before you go there, Dr. McLeod, really quick, tell for our viewers and listeners, can you tell us what is methadone and what is it used for?
Absolutely. methadone, which people tend to confuse with methamphetamine. So these are absolutely not the same at all. Methadone is a type of opiate, and it's used as a medication, medication-assisted therapy for people who have opioid addiction. It's longer lasting than, say, typical painkillers or heroin or morphine. Stays in your system about 24 to 36 hours at a consistent basis. And so it's used basically to help people get off of the illegal opiates, heroin, painkillers, morphine, fentanyl, those kinds of things. Because it stays in your system, the goal is to prevent withdrawal symptoms, which is one of the biggest factors in people relapsing on opiates.
Right.
Correct.
It can be used for detox. Or it can be used as a longer-term maintenance therapy where a person's taking it every day. Again, it's not an intoxicating effect. They won't get intoxicated, but it prevents the withdrawal symptoms from hitting.
Right,
And
so it
we
helps
tend
them
to
to
see
function normally.
a much better. I'm sorry?
So it basically helps them function normally to where they can go about their daily life and not, like you say, experience those withdrawals.
Yeah, we don't have the ups and downs of illegal drug use. And so, yeah, people can get and keep jobs, repair and engage with family members and friends and recreational activities, and not having to constantly worry about seeking drugs.
Other words,
but we do see a lot of good,
other words, it helps a person live a more normal life because we know that obviously the opioid use, heroin, or even painkillers, it has a major impact in person's overall quality of life and obviously family overall and functioning, either be through work, relationships, and so forth.
Right. So the original question was, do you see a difference between those individuals that come through methadone treatment or individuals that use traditional counseling methods?
Well, I saw them in different settings. I would say that, and the research really backs this up, that for people who have methadone maintenance, or even Suboxone, which is a kind of a related drug that can get outside of a clinic, that serves the same purpose. But the research has shown much better outcomes, up to like a 50% decrease in the death rate, like from overdoses.
So let me get this right. Just 1 second. So if a person is being treated for opioid use with methadone or Suboxone, there is 50% less death occurrence due to the substance.
Yes.
Okay. Thank you.
You're welcome.
Okay. Now, what is it something that our listening audience should know regarding the holidays and addiction?
That's a great question. So the holidays really are a difficult time for people in recovery. Depending on where that person is, if they're in early recovery, it can be especially difficult because they're learning how to cope with being around people who are drinking and not drinking themselves, or other kind of stressful situations that they find holidays to be stressful. And so I would say being supportive of the person, maybe limiting your own alcohol use around them to prevent any kind of stress or cravings or things like that. I would tell people who are in recovery, maybe this is going through their first holiday, to have a good support system. There's a lot of communities where they will have 24-hour AA or NA meetings going on during these times. And so it makes it a lot easier to find and go to attend a meeting. And now that they're all virtual, too, they can be easier to attend. And so using those as platforms in areas where you can get that social support and having other people that you can turn to and call to when things are feeling tough, but not pressuring people to explain why they're not drinking, just accepting it, not trying to pry too much into that, letting people have some flexibility and space if they can't stay the whole time, really just touch it, keeping in touch and asking what they kind of need that would help them to get through this time.
There's another area, Dr. McLeod, that I want to talk to you about, and I know you're familiar with homeless population, and I know you've engaged, as we spoke prior to today's session here. Tell us about homeless folks, because clearly they are out there, right? And people are, at least in theory, celebrating. Minus the 2020, but usually this is a happy time for most people and celebration, the jingle bells and everything else. Yet we know we have a major problem with homelessness.
Yes, but before you get into that topic, everyone, you are watching In Session on WJZZ Cool TV, the coolest station in the world, and it is 5:30, and you can catch us on Facebook, YouTube, Twitch, and Periscope, and enjoy classic jazz music anytime via WJZZDetroitRadio.com. And you are in session with Dr. T.
Dr. Fishta.
And we have Dr. McLeod on the phone with us, and we are talking holiday blues and addiction. And Dr. McLeod is going to tell us a little bit about individuals and how they handle the holidays and facing homelessness. So you have the mic, Dr. McLeod.
Thank you. Yeah, so homelessness, there has been a huge increase in the homeless population this year, just due to the pandemic and the recession and the unemployment rate. And so this population is particularly vulnerable to mental health issues and addiction issues, and so it's not unusual to see those co-occurring issues happening, and it can be very hard to pull yourself out of poverty and out of homelessness without some intervention, especially if there is severe or persistent mental health and substance abuse issues. But I have seen with the proper interventions and enough time, I have seen a lot of great things occur, and people start to get themselves out of the homelessness cycle and live fulfilling lives.
Now, I have a question for you from one of our audience listeners who wants to know which comes first. Is it a mental health disorder or is it the addiction? And this is something that we have all debated in this field. So I think this is a good question.
Dr. McLeod, put that to rest once and forever. We've been arguing about that for a long time.
Oh, wow. I wish I knew which came first. I think that's really kind of an individual issue, because we do know that substance abuse can cause mental health symptoms, right? And so we kind of look at which happens first for the individual. Did they start abusing drugs and alcohol and then started to develop these, or did they have these symptoms, these mental health symptoms first, and they started to use drugs and alcohol as a way to cope with it? I see, for example, ADHD. I see that being people with ADHD that's untreated, they tend to cope with marijuana. That's a big corration that we see all of the time. But then they start to play on each other,
cope
right?
with what?
One will kind of worse than the other one.
Dr. McLeod was saying that individuals with ADHD
they cope with.
They use marijuana to cope with their symptoms.
Keep going, Dr. McLeod.
Yeah, and then we see a cycle, kind of a feedback loop happen, right? As more substances that are being used exacerbates or causes more mental health, which maybe kind of in turn causes the person to use more and more. And so we have this kind of a negative cycle that goes on. But we do know that these mental health and substance abuse do tend to co-occur a lot. I think about 50% of people with severe mental health issues are affected by substance abuse. 53% of drug abusers have a mental health disorder. and 37% of alcohol abusers have a mental health disorder. So it's
So,
not unusual.
so when we're talking about individuals that have um, two types of mental health disorders, that's called co-occurring or comorbidity. We just kind of want to let our listeners know some of the lingo that we use as well, that technical
Mm-hmm.
jargon that
Mm-hmm.
no one likes to hear.
Mm-hmm.
But usually, when you have a co occurring disorder, it is usually some form of addiction with mental illness. It could be a physical disability with addiction or a mental illness.
Also, Dr. McLeod, I quickly want to also engage. You mentioned ADHD when people treated themselves, so to speak, unfortunately. And also, there has been an increase in abuse of stimulants, which fall in line with methamphetamines and so forth. Uh, all in all, to stimulate mental functioning, cognitive abilities, and so forth. Are you seeing an increase in stimulant use or abuse, I should say? And the reason I ask you
Uh-huh.
this because you also are a professor at the university, and I know there's a major increase in university students for obvious reasons, exams and performance and so forth.
I haven't seen an increase in stimulants. It's going back to the homeless population. The number
Mm-hmm.
one drug of abuse with that population was crack cocaine.
Crack cocaine,
We also
okay.
have to consider, yeah. So I saw a lot of crack cocaine. We did not see a lot of opiates, but um, the people coming in with opioid addictions had been increasing um, over time. And so it really is kind of regional. It's like, are we looking at a rural area,
Mm-hmm.
an urban area?
Correct.
Um, the demographics of the individuals. That will kind of, we see use and what kind of drugs are being used,
Yep.
depending on those factors too.
Yep. You're correct because it wasn't too long ago. We're talking a decade or two where crack cocaine or even methamphetamines or opioids were an inner city major problem, right? But now it's a country problem. It's a continent problem versus being an area problem, and that's why I think it has come to be talked about as crisis. And you see the federal government trying to move on that, and so much for the war on drugs. Clearly, at some point we have to declare that a loss and move on from that kind of treatment and thinking. So, go ahead.
Dr. Malloy,
Absolutely.
with you being at the university, and I know classes aren't in now, but historically speaking, what are some of the causes that lead students to use and abuse alcohol and drugs?
Well, I would say, the peer pressure. There's a misunderstanding of how among college students about how much college students drink. They tend to greatly overestimate the amount their peers use. When we've done these surveys across campuses and things like that, and so they don't have a very realistic understanding of how much people actually do drink. And so I think that there's this perception that it's okay to use a lot. I think especially now, students are stuck inside a lot more. They don't like going to class physically. They're doing everything from their dorm. There's no more, or not a lot of student activities, extracurricular activities, sports, and so that's a recipe for boredom.
Yep. Which is the very activities we often recommend to students, right, to engage and so forth. Now we're telling them not to do it, so which can clearly be a trigger, so to speak.
Okay.
Absolutely. And so that makes it a lot more difficult with isolation. Boredom will often lead to an increase in drug and alcohol use.
Okay. Now, what about their course load? Does that contribute anything to any type of use?
I think it can. I think it depends on the individual. If they are very concerned about grades, high achievers, perfectionists, they may use it as a way to kind of blow off steam. like we mentioned with some of the stimulants like Adderall, Ritalin, the performance enhancement.
Mm-hmm.
But I tend to see a lot where people end up using drugs and alcohol too much and end up failing their classes. They don't attend their courses. And that
Oh,
causes a lot of other
I think you're
adverse
talking about me
issues.
my freshman year of college.
And that's the thing too, Dr. McLeod, because there is this idea that kids go off to school and sure they'll party and they'll do stuff, but then you have um, some of these young folks will get caught up in this addiction for life, and others move on just fine. And I believe that leads into some form of possible predisposition in their genetic makeup. And I don't know how true that is, but some experts are starting to blow that horn as well.
So, what are your thoughts on that, Dr. McLeod?
Absolutely. About 10% of people who use drugs and alcohol will become dependent.
Oh, okay.
And so it's not unusual to see, college students abusing alcohol and drugs, at kind of, we would say, a level of abuse. And then over time, they graduate, they get jobs, they have the regular 9 to 5. A lot of them they start to experience the consequences. Hangovers happen faster.
Mm-hmm.
They're not recovering as quickly. They have other responsibilities. And they kind of make this natural decision that it's not really worth it. They may still, use socially and without issues, but it won't be at the same level. Whereas there's a small percentage of people will continue that level of use. And there's certain factors, there are certain, predispositions. There's a strong genetic family component. People who tend to have a higher tolerance for alcohol, like people who say takes a lot for them to feel the effects. They tend to be more likely to develop substance abuse issues down the line. And so there is definitely a genetic component underlies addiction for a lot of people.
Yeah, and I think that's with your explanation, that's the best we have, obviously, because
Mm-hmm.
we're unable to see some kind of genetic defect that would tell us that a person is more prone to being addicted or not. But again, by description of people using the same amount of substances and a certain amount gets addicted to it, and the number is pretty high, though, 10%.
Yeah, that's high.
Yeah, it is definitely. Also, Dr. McLeod, I want to ask you this, given that you actually have been engaged with the homeless population. We also know currently that we're going to potentially have a massive evictions coming through, given that the federal government's dollars will actually go away, and the executive orders to keep people in place, even if they don't pay rent or others, are going to be no longer there. What are your thoughts on that? What should be people looking out for that may be facing an eviction? Some thoughts there, please.
Yeah, I mean, we were in a bit of a housing crisis. I mean, at least in our area, in terms of affordable housing, before all of this hit.
Yeah, you can put us with your area as
Yeah, I
well.
think
Major
that's
problem
across
with
the board.
affordable housing.
Yeah,
Yes.
across this nation.
Yeah, and so I see this as being an absolute crisis that's about to occur, and we're going to see a huge explosion of more homeless people, or people who are housing insecure, jumping from place to place, or living in more dangerous situations that they normally wouldn't be living in, and that comes with an increase in not just substance abuse and mental health issues, but violence, physical issues. We have, a pandemic right now, and that increases transmission by being in kind of close quarters. And so we're going to need to kind of get together and have more charities and agencies that are available to house and clothe and feed and provide care to these individuals, and hopefully in a lot more long-term solution rather than just a short-term fix.
So now that we're talking solutions, can you give our listeners some suggestions on how to cope with the holidays and staying sober?
Absolutely. So, like I mentioned before, reaching out to your support network, creating a support network through 12-step programs or other kind of support.
So you're suggesting family support, to use group support such as NA, AA, SA, GA, or any of those acronyms.
Yes,
Okay.
absolutely. And I would say having good self-care.
What are a couple of
Getting
self-care
good.
tips that you would give someone?
I'm sorry.
What are a couple of self-care tips that you would give someone?
I would say just eating healthy, getting good sleep, consistent sleep, finding time to be by yourself and take care of yourself. Mindfulness meditation can be very helpful. Doing things that you enjoy that bring you pleasure, because that's what we want to do that for people who normally find pleasure in drugs and alcohol. We need to increase other more adaptive things that they can find enjoyable,
Right.
whatever that might be for the
Right.
individual.
That would trigger that same reward chemical in the brain. So I like that. Okay, so support system, self-care, and what else? Or is that
Boundaries. I think boundaries,
Yeah,
kind of
yep.
reevaluating boundaries within your family, and like is kind of triggering for you, and learning and using good communication skills to set those boundaries up front, and to try and create a dynamic and always kind of an emergency exit for yourself when things get kind of tough, knowing what your escape route's going to be.
now? Why is it okay for people to set boundaries?
Or good?
Oh, that's a great question. Because we deserve it. We deserve to be treated with respect and dignity. And I think that setting boundaries is a way of letting people know how we kind of see respect
Okay.
and dignity. It is a great way of kind of being assertive and preserving our sense of self.
Okay. Sounds good. So we have 3 methods. Do you have any others?
I think that and the escape route, knowing when to get out and what your plan is on getting out.
So kind of pre-planning it in your mind that things could go not your way, and having an exit strategy, so to speak, sounds like Dr. McLeod, right? How about families?
Absolutely.
Families who have members of their families or close friends or partners and so forth that they're concerned about an addiction with their family member. What are some thoughts there? What can family do to support and help?
That's tough. There's a lot of different philosophies around that. I would say, kind of looking at how is this affecting, what ways is this kind of affecting you? We want to not enable. We also don't want to necessarily completely withdraw affection, right? And so actively choosing not to be around a person if they are engaging in substance abuse and letting them know, I really care about you, but I do not want to be around you when you're engaging in this behavior. And so I'm going to go, to see family, to go over here, or maybe, you need to go see a friend or stay somewhere else until you're done.
Right. Now, family
And
can
so I
also
think
be
being able to keep
supportive.
those boundaries.
Okay. Now, I think family
Okay.
can be supportive by being a listening ear too, because oftentimes, that family member is going through something and they just need someone to talk to at the moment. So if you can just be a listening ear, will go a long way without being critical or judgmental, but just listening.
Absolutely. I think it depends on where this is a new development too with addiction. If this is outside this person's norm, then absolutely checking in with them, seeing everything is okay, what's going on, if they need any kind of additional help or support, being willing to keep that door open. I think is the most important piece.
Okay, and also with students that who may or may not be traveling this year, clearly the holidays are different for students in so many ways. Some universities are saying if you go home for Thanksgiving, don't come back. Basically, they're being blunt about it. This has changed the status quo, the life as they knew it. What are your thoughts there, or tips, or anything you have to say about that?
I think it's especially hard for adult children, especially those who are in college and experience a certain level of freedom, to have to go home for extended periods of time. And they find that they're kind of treated like they're still in high school again, which can be very frustrating for them. And so I think having some conversations about how do we want this to look while we're home, in terms of, splitting chores and boundaries. I think having a family meeting up front is what I usually encourage college students to
So
have.
kind of having a plan and talking about it. Sounds like you're saying having a plan, talking about it, and addressing some of these major issues that everyone is faced with.
Yeah.
Okay.
Okay. Well, you know what? We want to thank you for joining us today. This has been a very stimulating conversation. Before we get off the line with you, is there anything that you would like to add?
No, I think that's it. It was very comprehensive. I hope everyone has a safe and healthy holiday season.
Thank you. You do the same, Dr. McLeod, and you take care of yourself, and thank you for all you do out there.
Right. And if anyone wants to contact you, how can they do so?
They can email me at Bailey, Bailey, at bpmcounseling.com.
All right. Thank
Wonderful.
you very much.
Thank you. Be safe and healthy.
And we may call you
Thank
back
you.
another date to join us as we talk more about addiction and the genetic components of it.
Thank you, Dr. McLeod.
Absolutely.
Have a great evening.
Yes, and happy Thanksgiving to you.
Thank you.
All right. Bye.
Thank you.
So what a great conversation about such sensitive topic, Dr. T. I personally, given what I do, I'm concerned making it through these holidays for a lot of people, and then with these evictions we're talking about, and all these triggers for either be a relapse or for people to actually start covering their emotional pains and their thoughts that are so painful, and there's no way out, feeling stuck, and so hopefully families, friends talk to each other and support each other in the best way possible.
Absolutely. So how do you talk to your children about addiction and this time during the holidays, or how to deal with stress during the holidays?
Well, I don't know that they're stress course. I think they're well, they are, and obviously their lives have changed as well. I talk to them about it. I try to engage as much as I can. Now, I have a 21 and 19 years old, so it's not the easiest thing to do, to sit down and have a talk, a long conversation, and discuss all these topics. However, I do when I find opportunities. Usually, a nice dinner works for them. Food, you have to deliver something they really like. Now, given that the restaurants are closed, so you can cook at home, but good luck, using that as so. But basically, having a conversation, and also, Dr. T, every year we go out and help and feed homeless people. Also, there is a federal homeless count in Wayne County. All of us go out, do it every year. Usually that's in January, in order to receive funding for homelessness from federal government. So they've been engaged in those ways, and I have them help me with other stuff that I do. So they're aware. I think fairly so. At least I feel that way. So we'll see.
So
but so far so good. In that area. Yeah.
What it sounds like to me, if you're a parent, you should start this conversation with your child in the home and tell them about addiction, what it can lead to. We've always heard, I know ever since I was a kid, say no to drugs, say no to drugs. Yeah, but why? So sometimes you have to give that why behind it. But I want to thank everyone for joining us this week on In Session. You have been listening to us or watching us on WJZZ Cool TV, the coolest station in the world. And we will be back with you next week.
Yep. Next
Will
week,
we be back
same
next
time,
week?
same place.
Next week
it was
is Thursday,
Thanksgiving,
right?
so maybe not.
Yeah.
Maybe not.
So I think we're going to do a recap of one of our shows.
Yep.
So Dr. Fishta and I, Dr. T, would like to wish you all a very happy Thanksgiving, and we hope that you all stay safe.
And please abide by CDC and State of Michigan guidelines.
All right.
Thank you. Yeah, we're not on, are we? We're not on, are we?
We shouldn't be, not any
Okay,
longer.
so I was reading this headline, right? Amid one of the worst crises that faced the country in decades, President Donald Trump is nowhere to be found. Great leadership.
Well, you know what? Wasn't like he was doing much anyway, so
Well, I'm
let
happy
Pence handle it.
this misery is going to end soon.
Yeah.
It gets a bit warm in here. I think after a while I almost wanted to take my shirt off.
Listen, I wanted to take my shirt off, my wig off. I'm like, it's hot in here. Oh my gosh, I'm gonna vomit if I don't get out of here.